Rebecca, my name is Jennifer and I'm Mr. T's occupational therapist, and I'm going to tell you a little bit about what's going on with him sensation-wise. He was concerned that due to his frustrations he can't exactly express the way he's feeling right now. So I know you were wondering why you could hold his hand on the left side of his body but not the right side. Is that right? Well, I'm going to tell you a little bit about that. You have all these receptors in your body that send signals to your brain through your spinal cord. Now we know his injury is on his spinal cord on the right side. So any of those signals traveling up the right side of his spinal cord get blocked at his point of injury. So those signals never get to the brain for the brain to interpret, meaning that he doesn't feel certain sensations that travel through that pathway, or like road, like a highway almost. So for example, you can hold his right hand, he can't feel it. And that's because the receptors that allow him to feel things like touch or know where his arm is in space, those types of receptors travel up the spinal cord on the same side of the body that they come in on. So it's his right side. They come into the spinal cord on the right side and travel all the way up to the brain on the right side. Well, he's got that injury there on the right side of his spinal cord, which blocks those signals. Therefore, he can't feel. Now the left side of his body, you're wondering probably why it's affected. If the injury was on the right side, why is his left side affected? Well, certain receptors, like pain and temperature, they actually travel differently than his feeling of touch. So on the left side of his body, if he gets hurt, those receptors come in and they cross over to the right side of his spinal cord and then travel all the way up his spinal cord on the right side until it gets blocked. So does that make a little bit more sense as to why those signals aren't getting interpreted in his brain? Well, it's going to be really important for you to take care of yourself. You're going to be part of the recovery process. And most of the recovery takes place within the first year. So it's going to be really important that you be patient with him and not get discouraged yourself in the immediate future. I'm going to be here with you guys every step of the way. You're welcome to join any therapy sessions. I actually encourage it. And I want you guys to take note of things as you notice him having problems so that we can work on him in our therapy sessions. Let's see, what else? Make sure I'm not forgetting to tell you anything. I'll give you my card before you leave, and you can feel free to give me a call anytime. We're going to be working together a lot over the next year, and probably more. My goal is to get him to function as independently as he can again. So just let me know if you have any questions. Thanks for coming in, Rebecca.